Now, cognitive therapies, again, have been proven. They can be very helpful, but in this situation, I'm a little more hesitant because it's not dealing with that emotional part of the brain. It's not dealing with the limbic system. It's more cerebral cortex process. Stress inoculation is a set of theories which help people deal with stress and help them deal with the physiology of it through some cognitive techniques, cognitive behavioral techniques, but also relaxation, meditation, again, the desensitization of these memories seem to be very helpful. And then the last one is a more controversial therapy, but the research is looking good. I don't understand how it works. It involves the therapist having the individual move their eyes back and forth and then go back and recount aspects of the traumatic experience. And something in that visual process does seem to soothe or relax the amygdala. So it's not as active, and that allows, again, this desensitization of the memories.
Are you going to do the medication too?
Yeah, after you.
Okay. We believe that if you have simultaneous individual and group therapy together, that's the most efficient. They have two group therapists, that you have a female and a male. And that's helpful to the therapist and the patient. That groups are essential to help people contain feelings because they have other people in the group they can look at and they can hold each other with their eyes. No touching, that's part of the non-acting out contract. That you also make sure that everything that goes on in that group, that each patient commits to confidentiality about other people in the group. They can't go home and say, guess what, Jim Smith's in my group. He's down the hall or down the block. That be essential in keeping this group safe. I believe, Michael and I both believe that the group should be homogeneous, that you don't mix veterans with civilians. They're civilians, I know, but you know what I'm saying. People with military experience with civilians. Veterans tend to close up because they want to be with people that they feel safe with, that they can talk about these things. Also, very important that everybody go very slow. This is not something you get done in 20 sessions. This is something that you have to do very slowly. We slowly stimulate the amygdala, have the person breathe, stay present, make eye contact, stay in the room, and we slowly get toward the memory. Like you said, talking in the morning about what happened. And that might take weeks just to talk about what happened that morning. And the person's heart rate increases, you help them breathe, help them stay in the room. We're going on this very fast, but we know.
We want to make sure we have time for some questions.
Yes. Thank you.
In terms of the medications that are often used, and I'll just go over them quickly, the old antidepressants, the tricyclics, are still used somewhat, MAO inhibitors, but really it seems like the most effective group of medications are the SSRIs, the selective serotonin uptake inhibitors, which are really the newer antidepressants, and two that have been cleared by the FDA for use with post-traumatic stress disorder are Ipaxil and Zoloft.
And you got to talk about side effects so they know what's going to happen.
And in terms of the SSRIs, they are effective for individuals, but particularly for young male veterans coming home. The SSRIs have a very large percentage of individuals have sexual side effects.
Well, also the females sometimes have a hard time having orgasms. And I'm not against Viagra, what the heck, you know? Person needs help.
But my experience, it can be very frightening to teenagers and young adults, all of a sudden to not be as interested, to have some trouble in the sexual arena, particularly if they're kind of macho. So it's important to help them understand that this is a short-term treatment, that there are some things we can do to help them with that, so to speak, and, you know. And so it doesn't come as a shock. Again, if they don't know, they're just going to freak and get off the medication. You know,
keeps people in the group.
Yep.
We talk about everything. Doesn't matter what it is, everything.
Other medications, some people are using some anticonvulsants. One of the things I'm very interested in is that there's some research that if very quickly after the traumatic experience, the individual can begin to take beta blockers, which dampen the sympathetic nervous system. It's often used for migraine headaches, for some kinds of anxiety disorders. That seems to greatly decrease the chances of developing the post-traumatic stress syndrome.
It's also good for public speaking. That's what I've been told.
And then community resources. Carolyn?
Do you have those? Oh, okay. If you need help, you want to get help now, there's a local clinic started by a Vietnam vet, grassroots guys. It's run by the National Veterans Foundation. They give you information and guidance in obtaining veterans benefits. They'll help out with food. They'll help out with clothing, shelter, nurse you, but help you out. The Grand Rapids Clinic number is, do we have this typed up somewhere?
It is. It's
People
typed
can-
out on.
outside?
By the way, there's a handout outside on the table
Okay.
with all this information and some other information.
Okay,
too.
it's out there, but it's 616-365-9575. That's different than the Veterans Health Administration. That's a little more cumbersome as far as red tape goes. Give an hour is if you are a therapist, I recommend you go outside and you get one of those leaflets or pamphlets that has a guy in the Kevlar and the helmet. That is where therapists, if you go through their process of elimination, you're a qualified therapist, you give 1 hour a week free to a veteran or their families or somebody who can't afford or don't get veterans benefits. 1 hour a week free until that person's completed their treatment, and then they have the dignity to give back to the community. They're required to give back to the military community or somebody else that's in need. So I recommend that you do that. If you can't afford therapy, then get online, go down to the library, get online, call or check out Give an Hour, and there's a list of therapists in town here. I'm one of them. If you are in an emergency, insist on going to the emergency room, but insist on getting a psychiatric consult. Do not let them tell you your insurance doesn't cover it. Tell them they're going to have a problem with continuity of care and liability if they don't give you a psychiatric consult. For long-term treatment, the Battle Creek VA Medical Center is for long-term hospitalization. That is also online, and that information is outside.
One thing, if you are a psychotherapist and you're interested in this and would like to begin a conversation about how we as a community can help these individuals, there's a sign-up sheet out on the table. Just has name, telephone number, and your email address. Please sign up and we'll get in touch with you. There are resources, but I don't think they're enough, particularly for people in crisis. And I'd like to begin a discussion as a community about how we can fill in the gaps.
Or even start a crisis team.
Exactly. So if you're interested in this, please give us your information, or just contact us. Just give Carolyn or I.
We'll get together, we'll meet, we'll have coffee, we'll do something good. So.
Good. Great, and I think that's the end of it. So,
thank you so much.
Feel free to come up. Yeah, thank you very much. Feel free to come up and ask the questions. Or come up to the microphone if you would. Or let us give you a microphone.